today we'll be doing something called as the muscles of forearm. Remember something, muscles of forearm are very important for most of the functions of understanding elbow joint as well as the wrist joint. The muscles of forearm, you have to just remember something called as a number 20, okay? This is a number for you to remember. So if this is the forearm, I hope you people know, this is the forearm, this part, this is the hand, this is the forearm, which I'm bending now with the elbow joint. It has two compartments. What I'm seeing is the anterior compartment and the posterior, also called as the front of the forearm and the back of the forearm. So these muscles conveniently have been divided into the flexor compartment, which is also called as the anterior compartment, as well as the posterior compartment, which we'll deal with in the second video. So this is the extensor part of it, and this is the flexor part of it. You know what is flexion as well as extension. How to remember these muscles? The anterior compartment muscles are totally two in number, mainly superficial muscles as well as deep muscles, what you're seeing here. So these muscles are actually, superficial are 5 in number, and this is 3 in number, and the muscle names are, number 1, Pronator Teres, pronator. It's supposed to do pronation. It is triangular shape, quite big, and it is large triangular shape, hence the name Pronator Teres. The next one is the Flexor Carpi Radialis, responsible for flexion towards the carpals and arising from the radial region, hence the name Flexor Carpi Radialis. Next we have Palmaris Longus, palm, going towards the palm, and it's quite very big. Anatomically, it's supposed to be called as longus or long. Next we have Flexor Digitorum, Superficialis, responsible for the flexing of digits, and it's superficial. That's why the name Superficialis. Next we have Flexor Carpi Ulnaris, responsible for flexion, but it's towards the ulnar side, hence the name Flexor Carpi Ulnaris. So this is the muscles of the anterior compartment, superficial region, 5 in number. Next, we go for the deep one. The deep one has certain relationships. If you saw the first one, if you see this Flexor Digitorum Superficialis, its wife is present here, called as Flexor Digitorum Profundus. Profundus anatomically means quite deep or yeah, it's quite deep and quite deep. That word profunda means quite deep. So it's the opposite of it. So you have superficialis here. Here we have deep. Next we have Flexor Pollicis Longus, the second muscle here. It's also quite long, hence the name longus. Then we have Pronator's wife present here, Pronator Quadratus. It's supposed to be a quadrilateral shaped structure muscle, just holding the two ulna and radius lower ends together. Hence the name Pronator Quadratus. So remember, the formula for flexion is 5 and 3. This is the diagram, very good diagram is given in the book. Let's study about these muscles now. Remember some common thing, all these 5 muscles, what I just told you, have a common origin called as the common flexor origin, which is arising from the medial epicondyle of humerus. Osteology, you must have seen the medial epicondyle. Above the condyle, you have medial epicondyle, epi, above. So this is the common flexor origin for all these muscles. So starting with the first one, number 1, the triangular shaped muscle, Pronator Teres, arises from the same common flexor origin, but inserted in the middle lateral shaft of the radius, responsible, as the name indicates, responsible for the pronation of the forearm, the first muscle. Next is a Flexor Carpi Radialis. The arrow goes upwards, means the same origin, just inserted into the second and third metacarpal bones towards the base region, responsible for flexion as well as, very important thing, abduction of the hand, this muscle, radialis. Palmaris Longus, as the arrow indicates, the same common origin. It pierces goes towards the flexor retinaculum. What is flexor retinaculum? If you people draw this particular wrist here, and this particular, you have a wrist bands type of structure, there's a separate video for that. This is called as the flexor retinaculum. It plays a vital role in our carpal tunnel also. I'm studying this thing. So this particular structure, Palmaris Longus, is arising from the same origin but inserted into the flexor retinaculum, as well as something called as the palmar aponeurosis. And this also does the same function, the flexion of the wrist joint. Next one is the superficial muscle, quite seen in the dissection. When you just dissect the skin and the superficial fascia, you see this flexor digitorum superficialis. This one, little bit you need to go up and down here. It has an humero-ulnar head, number 1, which arises from the same common flexor origin plus the coronite process of ulna medially. So you need to just little bit work hard on this. This is the first 3 muscles. Of course, all of them have the same common flexor origin, as I told you in the first sentence, but it's a little bit more. And the head has a humero-ulnar head. Obviously, next one will be the radial head arising from the radius shaft, anterior part of it. So this particular muscle, the reason for this muscle to have such two origins is just now it divides into 4 tendons, which further divide into 2 slips going towards the middle phalanx, and they inserted from the 2nd to the 5th digit, 2nd, 3rd, 4th and the 5th digits. Hence the name of this muscle, flexor digitorum superficialis. And remember, this is responsible for flexion of the wrist joint. This muscle, this divides into 4 tendons very easily. The first muscle in the fingers you see from superficially is this muscle in the dissections. Flexor carpi ulnaris completely towards the ulna. This muscle again has a humeral as well as ulnar head. Yes, ulnaris has a humeral head arising from same common flexor origin, Ulnaris process of the plus the posterior border of the ulnar head obviously, and inserts into the pisiform actually, but what we see is more of the hook of the hamate. What we say is that hamate, one of the carpals, has a hook. It's meant only for this muscle. And goes on to insert to the 5th. We have 2nd, 5th. So only one thing was left here. 5th metacarpal bone base, it just goes and helps. This is responsible for flexion as well as adduction of the hand. If you remember, this is the abduction, this is the adduction, opposition, what I'm doing it right now. So one important thing about this thing, the first 4 muscles, our pronator teres, flexor carpi radialis, longus as well as superficials are supplied by the median nerve. Only the ulnaris is supplied by the ulnar nerve. This is the only thing you need to understand in the superficial muscles. Very important question. It's going to be asked. And now let's go to the deep muscles. When we do the dissections and remove everything, the first muscle we come across in the deep is, as indicated, flexor digitorum profundus. This is a quite important muscle. It can be asked for either 5 or 2 marks separately. This muscle has lots of origin. Just you need to remember the 3/4 word here. This muscle arises from the upper the 3/4 of the anterior as well as the medial side of the ulnar shaft. And then also it arises from the same thing, upper 3/4 of the posterior border of ulna. So we have everything here, the medial side, the anterior as well as the posterior border, as well as the medial side of the Ulnaris process and the coronite process of ulna. So these are the 4 origins of this, the upper 2/3 of the anterior and ulnar shaft, medial surface, upper 2/3 of the posterior border of ulna, medial side of the Ulnaris and coronite process, as well as anterior surface of the interosseous membrane. If you see the 2 bones, ulna and radius, we have something in between them to hold and keep them tightly. This is called as the interosseous membrane, which is supposed to be a very important structure, giving allows certain arteries and veins to pass through it, but it's supposed to be holding these 2 bones together. And this particular muscle, after arising from all these things, it's again now, because it's a profundus muscle, deep muscle, passes through the flexor retinaculum deep to it and then forms 4 tendons for 4 digits towards the medial side, and goes all of these tendons insert into the palmar surface of the base of the distal phalanx. It's an important muscle. I understand it's quite difficult, and it again confuses you by telling you it has 2 nerve supplies, medially by the ulnar nerve, laterally by the anterior interosseous nerve. Medially by the ulnar, laterally by the anterior interosseous nerve. This is one of the muscles which is a chief grasping muscle, responsible for action grasping, flexor of the joints of the digits and flexor of the distal phalanx. This is the function of this muscle. Next is the flexor Pollicis longus, flexor, flexion, pollicis towards the thumb, and then longus, quite big it is, arising from the same thing, anterior surface of the interosseous membrane and upper 2/3/4 of the radius shaft. This enters the flexor retinaculum, like it has to enter with it, are inserted into the palmar surface. So fingers are done, only the thumb is left, distal phalanx of the thumb. responsible for just the flexion of the distal part of the phalanx of the thumb. This is the one, this muscle is meant only for the thumb because it has a variety of movements compared to the other fingers. It's more versatile. Next we come across a muscle, very easy, all muscles go down. This muscle is completely like this, Pronator Quadratus. I am quadrilateral shape, hence the name Pronator, responsible for pronation Quadratus. Arising from the ridge of the lower ulnar shaft anteriorly, this muscle arises and then immediately divides into two fibers, superficial fibers as well as deep fibers. Superficial fibers go towards the lower half, 1/4 of the radius, anterior surface as well as the border, and the deep fibers are inserted into the ulnar notch, the triangular area what you see in the ulnar notch, they are inserted there. This muscle, Pronator Quadratus, as the name indicates, supplied by the responsible for pronation of the forearm and binds. Its main function, as I told in the starting of the video, is the lower end of the ulna and radius is supposed to bind and keep them together. Elbow joint will do the function in the top, but this one is quite weak joint here, wrist, hence it just helps to keep it there. Remember, these both muscles, Flexor Palmaris Longus as well as Pronator Quadratus, are just supplied by the anterior interosseous nerve, which was common for almost everyone in the deep side except the first muscle, which was supplied medially and laterally by ulnar nerve. So this is the very important thing. Please go through it. It's a very important question. And you can take a screenshot of this thing. I'll come back here. I can take a screenshot of this. It's given in the book. Everything is given in the book. Nothing I have added new or something. This I will teach you in the next video. Yeah, I can hopefully understand the video. To subscribe and share. If any suggestions, you can always mail me. I just try to make the subject easy. It's quite difficult in the book, but just you have to understand the muscles of the forearm. Thank you.